One common misconception of epidemiology is that, we have that term, right, disease detectives. And so people think that we just do infectious disease. And that is far from the truth. We're looking at longitudinal data, meaning we're looking at data through time. We're looking at existing data and trying to identify, okay, what exposure is causing that outcome? Hi, my name is Dr. Cindy Lynn Salazar-Collier. I'm an assistant professor of public health with the College of Nursing and Health Sciences. I am a social epidemiologist. My work focuses on the prevention and management of chronic diseases. My work is basically in two camps. First part of my work looks at the determinants of physical activity behavior, namely looking at availability, accessibility, and quality of free, publicly available physical activity resources and the impact that that has on physical activity behavior. And then another part of my work looks at the influence of belief systems such as religiosity, spirituality, and fatalistic beliefs, and the influence that those belief systems have on health behavior and then result in health outcomes. All of my work is done among Hispanic populations, so Hispanic health disparity is a really important part of my work as well. Being Hispanic and living with a chronic illness myself for most of my life, I knew early on that I wanted to become or do something to influence this people's health. And early on in my career, like in my undergraduate work, I really thought that my path was going to be medical school. I quickly realized that I did not want to be involved in direct care. I went back to the field of public health. I chose then to pursue a Master of Public Health. And then during my MPH work is when I realized I really was drawn to the field of epidemiology because I liked that they're the disease detectives. I've been living with type 1 diabetes since I was 8 years old. Obviously, management is a really big part of that, like my physical activity behaviors, my nutrition, mental health, all of that is a part of wellness. And I wanted to be able to influence health in that way, and I wanted to be part of prevention rather than treatment, so public health was able to offer that to me. One of my goals, serving the Laredo community, to be able to, show community members, look at all of the great things that are offered to us, from preventative care to resources for you to, execute healthy behaviors, and to, allow that to hopefully translate into healthier outcomes for our community. So research opportunities are important to TAMU students, not only to, improve their career trajectory and to increase the odds of getting them a good job, but it's also really instrumental and monumental to the field of public health. Because, during my undergrad work, one of my mentors told me this, and I really hadn't recognized this as a strength. I actually thought it might even be maybe a disadvantage, but being Hispanic female, I bring a unique insight and perspective to my work that my peers might not be able to bring, who are doing the same type of work among the same type of population. So our TAMU students have that same advantage when we're designing studies, collecting data, analyzing data, interpreting research findings. We're able to do so through a lens that's a much closer mirror of what our target population is actually experiencing, because we've lived those same experiences. So some of the the barriers to health, whether it be like health education, health literacy, access to health services, mental health issues, discrimination, all of those things are part of our lived experience as well. And that's an advantage that TAMU students have. And I think that that is so beautiful and so wonderful about public health. And I really want my students to recognize that and see it as an advantage and see what potential they have in the field of public health that they can contribute.